Hello everybody, my name's Matt. I'm one of the advanced practitioners that works here in the IMAP service at the Royal London Hospital. What I'm going to show you today is a couple of tests to help in the diagnosis of a meniscal injury. The first and most sensitive test to use in the diagnosis of a meniscal injury is joint line palpation. What you're going to do is bring the knee up into about 90 degrees and then you're going to palpate, firstly medially, all the way around, including the posterior aspect of the joint line, and then you're going to palpate laterally all the way around to the posterior joint line as well. A positive test would be reproduction of their symptoms. The second test you can use to help diagnose a meniscal injury is the MacMurrays test. It's less sensitive but more specific than joint line palpation. What you want to do is bring the knee up into full flexion, stabilise the ankle and the foot against your hand and forearm. You're then going to apply an external rotation force to the tibia and bring the patient's knee out into extension. You're going to repeat that movement, this time with an internal rotation force onto the tibia, again bringing the knee out into extension. A positive test would be reproduction of pain or reproduction of any of their symptoms. Another test that you can use to help with the diagnosis of meniscal injury is the Festiva Test. You want to get the patient in standing on one leg with the knee in slight flexion, approximately 5 degrees. You're then going to take the patient's hands and get them to rotate their body to one side all the way around, making sure they rotate their shoulders and pelvis and going all the way around to the other side. Okay. A positive test would be reproduction of the patient's pain or any of their other symptoms. Another test you can use to help diagnose a meniscal injury is a deep squat. What you want to do is get the patient up into standing away from the bed. Okay. And now can you squat all the way down for me? And then come up again. A positive test would be reproduction of any of their symptoms.